at the rotator cuff muscles again, the glenohumeral joint. Supraspinatus, so there's the acromion process, there's the spine of the scapula, and so therefore this is supra, above the spine of the scapula, and it comes across towards the humerus in that direction from there. Very often this gets trapped underneath the acromion. Swimmers is a big problem for swimmers to do that one. And then if we look at the infraspinatus is this big red area here, then that just comes across towards the posterior part, so it spreads quite a bit across there, and that will do lateral rotation of the scapula. And then from here, this middle section of red along the lateral border, so that's the long head of the triceps. There's teres minor and there's teres major. So teres minor is roughly about as long as a finger that comes across directly towards the posterior part of the humerus. And then teres major comes underneath the humerus and it comes towards the front of the humerus. So it comes from the inferior part of the scapula towards the anterior part, just to the medial border of the bicipital groove onto the humerus. Subscapularis, difficult to see, but as you're looking at the scapula from there, and as you're looking at the scapula on me, then it's the front of the scapula. So it would be really deep underneath this area just here. Very difficult to probably see on video, but it's right at the front. It's very big. It's quite a big muscle. It's not a thin muscle. It's quite a big muscle. Supraspinatus, infraspinatus, teres minor, teres major, and at the front, on the anterior part of the scapula, is acromion process. Follow the spine of the scapula to the medial border. Just come a little bit above that, and in order to find the muscle becoming active, then Quinn just lifts his arm out, and that's supraspinatus. Acromion process. Follow the spine of the scapula to the medial border, then just come a little bit above that, press down, Quinn just lifts his arm, abduction, and the muscle becomes active to do that. Acromion process. Spine of the scapula, medial border to the inferior angle, lateral border. Acromion process, spine of the scapula, medial border to the inferior angle, and then the lateral border. And into the belly of that, if we just get then, the upper arm doesn't move, so from there it just gets tucked into the side, and the forearm, and that's infraspinatus, that will do lateral rotation from there. Infraspinatus, lateral rotation. If you're looking for teres minor, first of all, locate the posterior deltoid, so just put a little bit of pressure. There's the posterior deltoid. Find the edge of posterior deltoid that meets the lateral border of the scapula, and then from there push up as if you're pushing against the lateral border, and then from there just make like a V with the upper arm. The upper arm doesn't move, the forearm just moves backwards, and that would be teres minor. So it's underneath posterior deltoid. From here, posterior deltoid is what we need to locate first. So from there, there's the posterior deltoid. Find the edge of the posterior deltoid, and also find the lateral border of the scapula, and then push underneath. So you're pushing up towards the ear on the opposite side. Make a V between the upper arm and the forearm, and then it's the forearm only, not the upper arm, that moves backwards. Lateral rotation. So infraspinatus and teres minor assist each other to do lateral rotation. For teres major comes down the side here. There are lots of people that will not include teres major into this area, but to locate that muscle, then from there, what Quinn has to do very gently is to bring the elbow down towards the hip. And teres major just in this area here. Just push a little bit harder. There you go. That's teres major. This is posterior deltoid. Teres major from there. And then from here, if we turn him around, and then from there, I'm going to swap hands, And then from there, take that out here. We need to be looking up underneath here for, just around to the side, that's nice, just a fraction. Subscapularis is right up underneath that area there. And what I'm going to try and do is I'm going to try and lift the arm up in that direction. What Quinn will do is to try and bring the forearm backwards. So just move that backwards. That's what will activate the muscle. So from here, yeah. So up in here, there's a really nice tight area up in there for subscapularis, the major medial rotator at the glenohumeral joint. Supraspinatus, acromion process. Follow the spine of the scapula to the medial border. Just come a little bit above that. Press down. Stabilize their arm, because what Quinn's going to do now is try and lift the arm out to the side, and that will activate the supraspinatus. And then what we might do from here is use both thumbs, and so from that particular angle there, it's just a matter of just rolling the thumbs. And it's this part here that's just rolling in. So from there, press and roll. So you're trying to squash supraspinatus into the supraspinatus fossa. And be aware that it might be sore, so just take it easy. So that's underneath the great big muscle mass of the upper trapezius. Infraspinatus, acromion process. Follow the spine of the scapula to the medial border. If you're not able to determine where the inferior angle is, ask the person to put the back of their hand onto their low back and drop the elbow down. And that's the inferior angle just there. So they can take that back to the normal positioning. Acromion process. Spine of scapula, medial border to the inferior angle, lateral border, into the belly of that. They put their palm down. Try and keep their arm nice and straight. Keep the little finger down and just move the thumb up towards the ceiling. So that's lateral rotation. Yeah. And then for the teres minor, then what we're going to do from here is to take the arm out to the side. First of all, get Quinn just to lift the arm up. There's the posterior deltoid. Find the edge of the posterior deltoid as well as the lateral border of the scapula. They can drop their arm down and then push diagonally across. So you're pushing against the lateral border of the scapula, and they're just going to try and very gently laterally rotate. So the only thing that's moving is the forearm. And then again, and that is teres minor. Teres major comes down to this area here. So just put a little bit of resistance onto there. What Quinn's going to do is to try and bring the elbow down towards the hip, into that, and there is teres major. Subscapularis, to locate that, then if we just bring the elbow, the shoulder off, drop that down, so the weight of the arm is what actually brought the scapula into abduction. If we just lift that up, and then from there, just need to be a little bit careful. Some people are ticklish here, and try and push the bottom hand as far underneath as you can, and then curl the fingers up. So this hand in, and then just curl up. And then what they have to, they must move this part. If they just move the forearm, this is not going to work. They must move this part here. So there it goes. It really comes out quite predominant from there. Medial rotation. Okay, back onto the table first things. So if we're going to be doing some massage onto the infraspinatus, step the head. The muscle fibers will be coming across that direction. Now you need to be careful because some people, it's really sore in the midpoint here. So just do some dry massage. Do some compressions and do some knee cappies. So the muscle fibers are coming from the medial border and they're coming out towards the posterior part of the humerus. Stand at the head. And the reason for standing at the head is that if we do come down from this angle and go upwards, sometimes there's quite a sharp edge onto the inferior lip of the scapula. and that gets caught underneath there and it can be quite sore. So if you come from the head and just sandpaper down there, be really careful because some people are very sore about the midpoint. Impressions, and then some make happies. Vibration. If we take the arm out and either put that down by the side, or if you prefer to leave the arm on the table, provided they don't have a problem with their shoulder, then teres major, teres minor is in this area here. And what we're going to try and do from there is to get that thumb to go right up underneath. Just be aware that they might be ticklish. Keep the fingers nice and flat and just come backwards. Don't try and grab with the fingers, that will hurt. And so from here, and just try and make a little arc with the fingers. And depending on the size of the scapula, it depends on how many different positions you move to. If you find that that's awkward, then from there onto the edge, all fingers are closed up, the flat part of the fingers, and just sandpaper. Onto the lateral border of the scapula. Compressions and some make happies. For subscapularis, because that's on the anterior part, then from here, what we're going to do is to put the fingers underneath. The thumb is the focal point, and the thumb is basically going to go up towards the nose. Pull on the arm to try and pull the scapula away from the vertebral column, and then from there, once you've gone in, the thumb goes down. Go in. Now be careful, this can be really sore. And then from there, what you need to be looking at from there is if you can see the fingers, then from there, Quinn does medial rotation, so he's turned the humerus down towards the feet. And then once you've done that, the thumb then, if you can imagine, there's the subscapularis muscle, the thumb then moves to different positions, and one of them is likely to be really, really sore. So just be careful. Subscapularis, the major medial rotator of the shoulder. Infraspinatus is just there. Supraspinatus, with this particular kind of technique, it's not likely that you're going to get deep enough for this because the upper trapezius will take the brunt of the force. Infraspinatus, muscle fibers are there. Just be careful of your fingers because they may be ticklish, and press down and just slide down.